everybody, what is up? Welcome back to my channel, and if you're new here, welcome. My name is Victoria. I am a 23-year-old woman of transgender experience, and I make mostly LGBT content here on YouTube. If that's your thing, make sure you hit that subscribe button down below so that you never miss out on a new upload. As you can see by the title, this is going to be a 2-year post-op SRS video. Yes, it has now been 2 years since I've had my new best friend down there. I am so happy. It was the best decision of my life, so I have a lot to get into. Before I jump into this week's video, if this is your first time seeing me, my face, my channel, hi, how are you? Thank you so much for spending your time with me. While you're here, you might as well hit that subscribe button down below so that you never miss out on a video and you can join the family and give this video a big thumbs up. It helps out my channel so much. I do have several videos about my SRS on my channel, so if you're interested, I'll link one right up here as well as some in the description box down below. But in this video, I wanted to kind of reflect on the last 2 years, how I was before surgery versus now, sort of the recovery process. And I wanted to answer some of the questions that you guys sent me on my Instagram. So if you, yes, you want to join me on this journey, please keep on watching. Alright, you guys, so yes, as of April 23rd, I am now 2 years post-op. I had my sexual reassignment surgery, or SRS, or GRS, or bottom surgery on April 23rd, 2018 with Dr. Christine McGinn. Getting bottom surgery is not a requirement. It does not make you more or less of a woman. It doesn't make your trans identity more or less real. This surgery is for people that feel that they need it, and for me, it was something that was in the cards. It was something that I absolutely needed. Before surgery, I was so uncomfortable with my body on a level that I couldn't put into words. Whether it was things that I was wearing, a swimsuit, somewhere that I was going, or some kind of intimate experience, I couldn't fully enjoy myself because I was always thinking about how what I had between my legs was different, and what if someone notices, or what if someone sees, or what if something slips and all of a sudden it's painful? You know, I was always so preoccupied and I couldn't appreciate the wonderful things that were happening in my life because I was so caught up with trying to fix and align myself with my body. I was so miserable, and I knew that I needed to make this change. Now, this is not a change that you can make easily and overnight. So in order to get approved for surgery, you do need to jump through several hoops, especially if you're going through insurance. You need many different letters from many different doctors. If you're under 18, you need parental permission. You need to be living your authentic truth for, I believe, at least a year, including being on hormones. There are so many things and psychological checks to go through, as there should be. Every procedure is going to cost different amounts, different doctors, different procedures, different insurance carriers. But for me, I found that most people got their surgeries for around $20,000, excluding any kind of coverage from insurance. So for me personally, because I did go to Dr. Christine McGinn, she does take insurance, but in a reimbursement setup. So basically I paid upfront all of her fees, all the hospital's fees, and I waited about a year or so to be reimbursed through my insurance, which I was reimbursed, I want to say about 80 to 90%. Like I said, I have so many videos all about my experience, talking about the recovery, the actual surgery, how I feel now versus then. So I'm going to do sort of a glaze over, and then I'm going to answer some of your questions. If you guys have seen my other SRS videos, you would know that my recovery was no joke. Now, I am doing great. I have had 0 complications or anything. I am so lucky, knock on wood, that I am doing so well. But even when I was doing great, the recovery is still very tough, and it's very scary. I have had several of you reaching out to me with all of your deep questions about surgery. I know you're scared, you're concerned about how you're healing. Let me tell you, first things first, as you're healing and you're anxious about stuff in your head, the first person that you should be talking to about this is your doctor. Your doctor should want to have an open line of communication with you with all of your healing questions, especially because this is a less done procedure. And it's hard to just look something up on the internet really quick about your healing. So you need to have an open line of communication with your doctor. Don't be afraid to send photos or videos explaining how things look and asking for help. But let's talk about post-op. As I have said in the beginning of this video, I am now 2 years post-op. It feels like I've had this my entire life. I really can't even, I was thinking the other day, I was in the shower and I was like, I can't even remember what it looked like down there. I never took any pictures or anything. It was always something that it felt like, for lack of a better word, it felt like I had a tumor attached to my body, something that was actively killing me, and I had to just get it gone. And yeah, it's just so interesting how I just don't even, I guess my mind is kind of blocked out a lot of those memories. But I could not put into words how much my life has improved in ways that I didn't even realize it could. As you guys know, I am in a happy, healthy relationship with my boyfriend, Chris. This is our apartment. These are our plants. Well, they're my plants. In my relationships before this, before getting surgery, there was something in the back of my mind where I just couldn't see myself long-term with somebody that had seen me before surgery. This surgery has worked wonders at alleviating my dysphoria, helping me love myself, because even if I looked in the mirror and felt like, oh, I feel kind of fat today, or I could use some more curves today, whatever it is, I wasn't looking down and seeing something wrong. My sexual relations are amazing. I'm super happy. I literally I thought that I had it good before, because I mean, I feel like girls like us don't have a hard time finding people that want to be at least in the bedroom with us. It feels the same, if not better, if that makes sense, because everything is just lined up mentally. Like before, if somebody wanted to go down on me, I would be just gritting my teeth and bearing it, because I didn't want that to happen. I would just allow it to. Now, I won't get into depth, honey, but no complaints here. But more than more than even just looking at myself naked, I feel so much more comfortable in my day-to-day life. If you are considering this surgery, it is a very intense procedure. It is, of course, irreversible, and the recovery has a lot to do on your mental. But if you can handle it, if you can afford it, and it is something that you have truly thought about and that you truly feel you need, this surgery will change your life. It completely changed mine, and I'm so thankful to Dr. Christine McGinn. Thank you so much. I'm sure she won't watch this, but on the off chance that you do, or anyone from her office, thank you so much for changing not only my life, but the lives of trans women all over the United States and all over the world. Okay, so I asked you guys in my Instagram story to send me all of your SRS questions, and you guys certainly did. In the past, I have always just read your question and not said the username or put like the little question up here, but I'm going to, because I've gotten so many messages from you guys saying that you wanted your question displayed. So from now on, I will include the question. Natural Born Villainous asks, how long was the healing process? I would say you are not fully recovered until a year. You feel 100% at about 6 months, and it's really bad for the first month. I would say maybe around to month 3 is when you're back to work, back to normal. You're still doing a lot of recovery stuff, but you're still feeling pretty good. Sage_Cashdo asks, did you have to do electrolysis before, and for how long? Also, which surgeon did you use? As I said, I did go to Dr. Christine McGinn, and not all surgeons require permanent hair removal, but most surgeons recommend it. Dr. Christine McGinn does go in during surgery and scoop out all of the hair follicles so that you won't have any hair growing inside or anything like that. But that can also dull down sensitivity. So it is important that you do start early with your laser hair removal and your electrolysis. I have spent thousands of dollars, hundreds of hours on permanent hair removal. I've gotten laser hair removal, I've gotten electrolysis. I personally recommend a combination of the two. You guys know I talk about this product all the time because I truly believe in it and I love it, and I do use it myself. I love this Catch Beauty at-home IPL laser hair removal device. If you are just starting your transition and even if you're unsure if you want surgery or not, this will just get you that one step closer. I know when I called laser hair removal salons to get mine done, they turned me down because I was a pre-op trans woman. and that made me feel so bad about myself. I already hated what I had going on down there. So if you were uncomfortable with getting laser hair removal down there, I would absolutely recommend you get yourselves one of these. So if you are interested in trying this baby out, I will link her down below, but either way, you will need to do some level of laser hair removal or electrolysis for surgery. Bib_Aaron asked, do you have to go back to your doctor for yearly checkups? You do not. So you're supposed to go, depending on your doctor, of course, but for my doctor, it was, I believe, like 3 months and then 6 months and then a year. If you have any questions about your vagina, your vulva, you can just go to a normal OBGYN, but if you would rather, you can absolutely go for a checkup, but you don't need to. Hiccuplier asked, will you be able to give birth to kids like a real woman would be able to? Now, first of all, I am a real woman. I am right here. I am absolutely real, and I am absolutely a woman. Second of all, there are many cisgender women who cannot birth a child due to infertility or any other sort of problem. But personally, as a woman of transgender experience, no, we are not able to give birth to children, yet there is quite a lot of stem cell research and other things going on, so it's definitely a possibility. Sublavoy 2020 says, does it hurt a lot and when are you able to do day-to-day things? It doesn't hurt a lot. I would say my breast augmentation probably hurt more than my SRS, but it is very debilitating. You can do things for yourself again after about a month, but it's gonna be about until month 3 before you're able to hang out with your friends and go back to work and feel super comfortable doing most things. Same kind of question, that boy Caleb asked, what was the pain scale from 1 to 10? At its worst, maybe a 7. You know, there were certain times like when things were being removed at the very beginning, like taking out the stitches or dilating at first is definitely uncomfortable. But for the most part, it was like maybe a 3. It was more annoying and uncomfortable and debilitating. Jorg_Icons asked, how has your sexual pleasure and libido changed after surgery? I feel like my sex drive has stayed the same. I've always had a pretty high sex drive, but I feel like my sex life has improved so much because I'm comfortable. It is very much like a mind and body connecting experience. And I never had that before surgery, so now it has made my sex life and my personal pleasure so much better. How painful is post-surgical dilation at first? The first couple dilations are mostly just uncomfortable. It's not painful, it's just a little like, ugh. But then you get used to it. The Joelle 1998 asked, how is the pain the first 2 weeks and how is peeing for the first time afterward? The first 2 weeks were probably the worst overall. You know, the first week especially, I was in the hospital. I wasn't even in the recovery home, but it was 2 full weeks of me being in Pennsylvania, recovering and hardly walking at all. There were times when I was in a lot of pain. I know some girls that I went to surgery with and that I actually got connected with through the recovery home had a harder time dealing with it than I did, but I was also on a lot of meds, so were they, but I was on a lot of meds. I had a great support system and I was so happy it was mind over matter. In terms of peeing for the first time after, it's weird, especially when you still have like stuff going on, like bandages are packing, because you just don't want to like ruin anything or like soil anything, I guess. But the first few times, especially the first couple months, is going to be really messy. It's not going to be a perfectly straight line. A lot of the times it can even come up and out of the toilet, which is so bizarre, but your urethra is healing. So as it's healing, what can happen is the skin and the muscles around that can contract and it actually pushes it up, sort of like if you were to pinch before surgery, if that makes sense. So it can go in different streams, it can go all over the place. It should calm down as you continue to heal. If it doesn't, ask your doctor about it. But what's important to remember is females are kind of messy peers. Like sometimes it is a perfectly straight line down. A lot of the times it goes onto the leg or like whatever. It's very normal. So I wouldn't stress that about it that much. This person asks, how is my down there different from someone who was born with it and what are the limitations? It's not that different. It looks and feels the same. The limitations, I would say, obviously I can't get pregnant. I don't get my period. And I'll address this in a future question, but it doesn't get like soaking wet. So lube is definitely necessary, but it's not needed. Har_Johan asks, how long did it take to fully recover? I would say probably 6 months to a year to feel back to 100%. Swinch25 asks, what's your favorite position to do while doing it? Missionary, honestly, is just amazing because like something about the friction hits just right. Diego DBA asks, how sensitive is it? I feel like it's just as sensitive as any other genitalia. You know, I feel like I have full sensations still. Took me a little bit of time to regain it, but I'm back to 100%. It isn't more or less. I feel like it's exactly the same. Lana Horsting, I wanna say, sorry if I just butchered your name, but it says, I've had SRS 8 weeks ago. When did you start touching yourself and did you like it? It definitely takes time. I will say it takes some time after recovering to really get full sensation back and also not be terrified to mess something up by touching yourself. I think I started touching myself around like the 10-week mark maybe, and I had like a vibrator wand over like blankets and stuff to kind of really dull down the sensitivity. So get yourself a wand, first things first. Do yourself a huge favor and get yourself a little wand, yeah. And just be gentle. So take your time. I would say, I know for me, I was cleared to have sex and do everything at week 12. So wait longer than I did, wait maybe a little bit longer than you're at right now, but self-exploration, as long as you're gentle and just kind of seeing how things are down there, I think it's perfect. Candace_treasure says, I am terrified I'll never feel an orgasm again. Any advice? My advice to you is to find a good surgeon. You need to find someone who you have researched, you have looked on, you know, Susan's Place and other places, Real Self, wherever people go to post their surgery results, go there, see everyone's opinions on that surgeon, because for some people, they love one surgeon and hate another, and vice versa. I know some people prefer Marcy Bowers to McGinn. I personally prefer McGinn to Bowers. It's very subjective. That leads me into my next question, which is by How Dare You Just Say That? And it says, how did you find your surgeon? I went to my primary care physician, who is also my hormone provider. She worked with trans people all around the state, and she is one of the best in the area. And she has a full extensive list of surgeons that are sort of within her area and also all across the United States that she has worked with and that her other patients have gone to that she recommends. Now, your hormone provider should have a list like this. If not, research. Really just comes down to research. And even if you're discouraged by a long wait list or a price or whatever, there's really no amount of time or price that you can put on a one-time life-changing surgery. So make sure you do your research, make sure you are positive that you A, want the surgery, and B, are going with the proper surgeon. Ms. Queen asks, does it look and work like you wanted it to? Yes, 100%. It feels amazing, it looks amazing. I could not have had a better outcome, seriously. Goldfarb94 asked, do you still get phantom pain? No, I don't. I never really did, so. Matthew.Wedham asks, are there still scars? There are very hardly noticeable scars. I still have a little bit of hair down there that completely cover it. I would never notice it. I doubt a guy would ever notice it going down there. If it's something you're super concerned about, then take it into account. You can do things like rub bio oil or vitamin E oil on them, but they're extremely light, hardly noticeable, and it's worth it to me. Even if I had worse scars, it would be totally worth it. And the scars that I do have are hidden between the labia majora and minora, and they're just a little V that meets the base of the vagina. It's really hardly noticeable and it's very well hidden. June unreluctantly asks, is some/all of your dysphoria alleviated? Definitely a lot of my dysphoria is alleviated. If you've ever had a procedure, if you're a trans girl, and even if you just started hormones, or maybe you just got your breast augmentation or whatever, you'll know that those things help so much, push you in the right direction and alleviate dysphoria. But at the end of the day, we are all still transgender. We also have little things that we pick out about ourselves that we'd like to change. And I do still have some dysphoria. You know, I'm not a perfect person. There are little things that I notice myself that I'm insecure about. But overall, that level of insecurity, that level of dysphoria, I will never feel again. And it feels incredible. Again, June Unreluctantly asks, what's it like to never have to tuck again? Unbelievable, unbelievable. I still sometimes I'll go to pee and I am just so grateful that I don't have to like untuck and retuck and do all of that, and like I can go to the gym and work out and not have something slip and get pinched or start bleeding because it slipped and it got like rubbed against. It has made my life so much easier and so much better. Sophia Ocean asks if they can get wet on their own. And this is by far one of the most asked questions. And the answer is yes and no. I think it depends on the procedure that you had and who you are, your surgeon, your age, things like that. For me, yes, it does self-lubricate, but it doesn't get like extremely wet, so I do still use a lubrication, which is fine. Dilation, you will definitely need some lubrication. For sex, it kind of depends. You can either use none and your own fluids with your partner's fluids will work just fine. You can spit, you can use coconut oil, you can use lube, whatever floats your boat, but that is definitely a case-by-case question. Quant Life 88 asks, does your vaginal canal have an endpoint like a cis woman's cervix? Yes, there is an end to the tunnel. Your depth depends person to person, just like the last question, and it depends on how well endowed you were beforehand. So yes, there is an end to the tunnel, but so does every vagina. So Finding Myself 420X asked, do you ever worry you might regret it? And what was the worst part of healing? The worst part of healing was the not knowing, you know, having to constantly be in contact with my doctors, being like, is this normal? Is that okay? Am I gonna be okay? Am I gonna die? Am I botched? Like all of that. I ended up being fine, but that not knowing was really scary. In terms of regretting, no, absolutely not. And that's why I got the surgery, because at this point I wouldn't have gotten a permanent procedure if I thought I was gonna regret it. My girl Bambi asked 2 questions. She said, how soon were you able to return to work and how far into recovery was your first orgasm? I returned to work like 2 months maybe after getting surgery. I didn't have it wasn't a manual labor job or anything, so I didn't have to be down that long. The only thing is that you have to have a schedule so that you are able to dilate when you have to, especially the first 6 months or so. You need to really be strict to that dilation schedule. So you can go back to work pretty much like a month and a half or so after surgery. Just make sure that you have the time to lie down and actually dilate. And as far as my first orgasm after surgery, I think probably around the 10-week mark, like when I started messing around down there, 10 to 12 weeks or so is when everything fell into place, baby. Zuckermilk asks, any weird discharge problems? At first, you're gonna wanna wear a few pads because you will have some discharge, maybe even some bleeding or something at first. But as of now, no. I mean, I get a little bit like any other female, but nothing crazy. All right, you guys, that is going to be all for my 2-year SRS recovery update. Overall, like I've said in this video, I am so happy. This was the best decision of my life. Again, I just want to put it out there that getting surgery or not getting surgery does not make you any more or less of a woman. It doesn't make your existence any more or less valid. And before jumping into any permanent procedure, please do your research. Make sure this is something that you want and that you need in your life. And if it is, here I am 2 years later. I am living my best life and I could not be happier. Thank you all so much for watching this video. If you enjoyed it, please make sure you give it a big thumbs up. It helps out my channel so much. And if you are new here, please make sure you hit that red subscribe button down below, as well as the bell for notifications so that you are notified whenever I make a new video every single Wednesday, and like one extra video about once a month. I will link all my social media in the description box down below. I am so much more active on there. I will also link my WISIO if you have any one-on-one questions that you have for me. If you want to have a FaceTime call or a video response to you, I will link it down below at wisio.com/Victoria Rose. You guys are the best, you are amazing, and until I see you next Wednesday, good luck, I love you, bye.